smells of blood, the smells of death, the sadness, the screams. Every time a bomb goes off, even if I'm not hearing it in the makeshift theatre, I get your eardrums shake. You can tell that there's a bomb. They're bombing all throughout the night.
Well, Dr. Ahmad Al-Fara is the director of the Maternity and Paediatrics Department at Nasser Hospital in Gaza, and he joins us live now from Khan Yunis. Dr. Al-Fara, thank you very much for joining us once again on TRT World. Let me start by asking you, with many hospitals on the brink of collapse, what are the conditions like at the Nasser Hospital where you work, especially with so many people moving south? How overwhelmed are they, and what are the conditions like?
First, thank you for having me, my friend. Let me explain about the condition before evacuation of Gaza. Actually, we are talking about nearly, as I am head of Pediatric and Maternity Department in Nasser Medical Complex, I will give you the statistics that belongs my building. We are talking about 60% of pregnant women. They are nowadays in Khan Yunis city, they are complaining from famine and severe acute malnutrition. 1/3 pregnancy are classified as high-risk pregnancy. 1/4 children is classified as severe acute malnutrition. 1/5 children nowadays is born prematurely or intrauterine growth retardation. So this is before the evacuation of Gaza city. What you can imagine that the situation will be if 1 million people again came to Gaza, to Khan Yunis city nowadays. So the hospital is horrible in overcrowding. The patients are in the corridor, on the entrance of elevator. They are on the floor, on mattresses. So the situation is very, very critical and crucial and horrible nowadays after the evacuation of Gaza city nowadays.
You mentioned overcrowding there. Let's stay with that, because as you rightly say, the South is now overwhelmed, but it's not just the hospitals. With this new wave of arrivals, we're looking at overcrowding, the lack of sanitation, the lack of clean water. How much is that resulting in the continued spread of disease there in Gaza, and how much of a challenge is that to you?
Okay. Now this is the situation in Khan Yunis city. We have to mention that Nasser Medical Complex is now working instead of 4 hospitals. You know, my friend, that European hospital is completely destroyed and avoided. Abu Yusuf al-Najjar also, Emirati hospital also. So the only hospital is working is Nasser Medical Complex. Also, overcrowdedness with shortage of medical supplies, shortage of antiseptic, shortage of fluid. Today we have meeting with the NGOs that we are shouting about lack of simple medication like IV fluid. Ringer lactate is not available. Normal saline is not available. Even some instrument for external fixation and internal fixation for orthopedic procedure is not available. Paracetamol IV is not available. Some elective and selective antibiotic is not available. Some medication need urgently for acute flaccid paralysis that nowadays is widely spread in Gaza is not available, and we losing every day patient or 1 patient or 2 patients by that dangerous disease. So no words, no letters can express how we are suffering nowadays in Nasser Medical Complex, as the overcrowdedness and shortening of medical supplies and medication and the contamination of water. You know, we have nowadays some skin diseases like impetigo, We have nowadays acute flaccid paralysis, as I mentioned. We have nowadays gastroenteritis. A lot of cases coming to the hospital by gastroenteritis. I have to mention in the morning meeting today, when I have meeting with my colleagues, they mentioned that 950 cases came to the reception room within 24 hours. This number is a very huge number. We used to receive just 100, and in last 24 hours we received nearly 900. This is a horrible number of patients. They are coming to the hospital. In the same side, we have horrible situation according to famine and severe acute malnutrition. You can imagine that the out clinic for severe acute malnutrition used to receive nearly 20 to 30 patients. Last Thursday, they received nearly 140 patients. And I think that we will see more catastrophic situation if the borders is not open, if that criminal war not stopped, if there is no distribution for medical aids or for food supply or for milk for the patient or the people who deserve that supplies and that milk.
Dr. Al-Fara, just give us an idea, if you wouldn't mind, of how much aid is getting in, because yet more deaths from starvation, including a child today. How much food is getting in at the moment?
Yes, before, my friend, before the war, the need for aids is nearly, the demand for Gaza is 600 truck. Nowadays, just the incoming or the trucks that coming in Gaza is just 50. This means that just 10% of the demand of Gaza. This is the first. Second thing, that demand is not express what our need for Gaza. They send what they need, but they didn't send what we need in priorities. We have priorities for medical supplies, for milk, for antibiotics, for chlorine for the hospitals, for fluids for the hospital. They send for you some flowers, corn flour. They send for you something not belongs to resolve from famine. So, and another thing, that this aids is not going to the foundation or the NGOs like WHO, like UNICEF, like UNRWA, to be distributed among the people according to the civilian records. They have the ID card for everyone and the ID number for everyone. They can distribute it equally, and everyone can receive it. So again, this policy will aggravate the condition more and more, and I think we will see more deaths from famine. You know, we nearly the number of deaths is due to famine, nearly 400 or more, and I think the number will increase and increase. If we didn't open the borders and make the humanitarian aids is coming freely and unrestricted, this is will be like some catastrophic situation that we will get in.
Dr. Al-Fara, thank you, as ever, thank you very much for speaking to us here on TRT World.